Hello everyone, welcome back. As you may recall from our earlier discussion that tissue repair is achieved either by regeneration of injured parenchymal cells or by fibrous repair, or a mixture of both. Clinically, the repair process is called wound healing. A wound is a visible injury, usually one due to trauma. In this section, we will talk about wound healing. This refers to the body's replacement of destroyed tissue at a discrete site by living tissue. After this class, students should be able to compare different types of wound healing and list factors influencing wound healing. Injury to the skin, both traumatic and therapeutic, is common and clinical important, so it deserves further consideration as a special topic. Now, we shall discuss the basic stages in cutaneous wound healing. This is a process involving both epithelial regeneration and fibrous repair. Skin wound healing will go through the following major phases. Immediately after injury, the wound is filled with blood, which then clogs and seals the wound against dehydration and infection. Acute inflammatory response occurs within 24 hours. We can see neutrophils at the wound margins migrating toward the fibrin clot. By the third day, neutrophils have been largely replaced by macrophages, and then the ingrowth of granulation tissue from the periphery of the defect. Collagen fibers are now evident at the wound margins, but these are vertically oriented and do not bridge the gap. Wound contraction occurs due to the action of myofibroblasts present in the granulation tissue. The epidermal basal cells proliferate and migrate inward from both wound margins. A well-approximated wound is covered by a layer of epithelium in 48 hours. Over time, collagen fibers become more abundant and begin to fill in the wound. A continuous epithelial layer is reestablished. I hope you can appreciate that events in wound healing overlap to a great extent. Depending on the nature and size, skin wounds are classically described as healing by first and second intention. These processes are analogous to tissue repair with nearly complete restoration of normal function and repair with loss of function. One of the simplest examples of wound repair is the healing of a clean, uninfected surgical incision approximated by sutures. This is referred to as healing by first intention. As we can see in this diagram, the incision causes only focal disruption of epithelial basement membrane and death of a few epithelial and connective tissue cells. The narrow excisional space is first filled with fibrin-clotted blood, and then is rapidly replaced by granulation tissue and covered by new epithelium. During this process, epithelial regeneration predominates over fibrosis. A small scar is formed, but there is minimal wound contraction. In other situations, large defects in which the epithelial margins are far apart, or in which a significant portion of skin has been lost, would be healed by secondary intention. The repair process is more complex. Unlike primary healing, the inflammatory reaction is more intense, with large amounts of granulation tissue. This is followed by a large scar formation with loss of normal skin appendage. These principles have a practical application in surgery. Wound management aims to prevent healing by secondary intention. Therefore, surgeons should remove necrotic tissue from the wounds, prevent and treat wound infection, and if possible, bring together the edges of a big wound to promote first intention healing. Many factors can delay or stop wound healing. Local issues include wound infection and foreign bodies left in the wound. Others are host-related general factors. Basically, there are two main systemic factors affecting wound healing: the age and nutritional status of the individual. The repair process is rapid in young people and somewhat slower in age. There are many reasons for this, but not all are known. Some explanations include the relatively poor blood supply and suboptimal nutritional status in the elderly. Poor nutrition will cause a deficiency of substances needed for effective wound repair. Protein deficiency, particularly lack of vitamin C, will inhibit collagen synthesis and retard healing. Since the trace element zinc is required for normal function of enzymes contributing to repair, its deficiency will slow down wound healing. Wounds in patients with diabetes are especially slow to heal because of microvascular disease. This slide lists the local factors that may prevent a wound from healing. Infection is the most important cause, as it prolongs the inflammatory phase and aggravates local tissue injury. Foreign bodies, including pieces of metal, wood, or glass, may physically obstruct the wound closure, cause intense inflammation and infection. As mentioned, poor blood supply also impairs healing. Excessive movement will prevent granulation tissue from filling in the wound and can re-injure tissues undergoing repair. This is particularly important in fracture healing. Exposure to ionizing radiation hampers tissue repair, as it can interfere with granulation tissue formation and local blood supply to the wound. Now, I would like to give a brief summary of tissue repair. Regeneration is the replacement of lost cells by division and proliferation of adjacent healthy cells to restore injured tissue. But not all body cells divide at the same pace. Depending upon their capacity to divide, tissue cells can be classified into three groups: labile cells, stable cells, and permanent cells. As shown in this diagram, tissues usually take different measures to repair based on the degree of damage and cellular constitution. If minor or limited injury arises in parenchymal tissues capable of proliferation, regeneration would ensue, with complete restoration. But extensive damage destroying the stromal supportive framework is restored by the combination of regeneration and fibrous repair. Fibrous repair begins with granulation tissue formation and culminates in the laying down of fibrous tissue. Granulation tissue is a mixture of proliferating capillaries, fibroblasts, and inflammatory cells. Over time, as most vessels regress, inflammatory cells disappear, and collagen accumulates. Granulation tissue mature into scar tissue. Both regeneration and fibrous repair occur in wound healing. Skin wounds can be healed by primary or secondary intention. Compared with healing by first intention, secondary healing involves more extensive scarring and wound construction. Wound healing can be altered by a variety of influences. Some variables may act locally, for example, wound infection and foreign bodies. Systemic factors including age and general nutritional status of individuals also affect the repair process. All right, that's all for this chapter. Here are the references. Thank you.